This is the 37 COVID-19 isolation center. Since it sprang up in March this year, it has seen over 120 persons, some of them now fully recovered. But how has the facility been faring over the past 3 months? That's what I'm here to find out. The 5-unit center is originally a UN peacekeeping level 1 hospital. With a 15-bed capacity, it basically serves as a holding place for regular patients of the 37 military hospital suspected to have contracted the coronavirus. Confirmed cases are moved to the Elwak COVID-19 isolation center for treatment.
We also have people who are exposed. If they feel they've been exposed to a confirmed patient, they can also come in here where the swabs will be taken for the test. And if their home situation is ideal for them to go home and self-isolate at home whilst they wait for the result, then they can also do that. We also receive referrals from hospitals who may have picked up suspected patients and don't have a place to isolate them or manage them. They also call and they refer some of those patients here, and we accept and manage as well.
With the partial easing of restrictions to allow for some social gatherings at churches, mosques and schools, authorities here fear a spike in cases will overwhelm the facility and its staff.
That is a major concern to all healthcare workers all over the country, that once we're going to ease the restrictions, people may not really comply with the protocols that have been put in place, and so we're really going to have a surge in the numbers. So that is a major concern for all of us. If we have more people showing up at any point in time, we will be overwhelmed, and that may be difficult to handle, and that is why we have concerns about the easing of the restrictions, that maybe we may run into trouble.
So this is one of our isolation wards. It can house up to 5 beds. But right now it just has 2 beds for our patients. Okay. We try not to overcrowd them so much just because we try to keep to social distancing.
Okay. So has there ever been a point where you've had to take like maximum number of people, or it has always been this free since you began?
In the course of the months as COVID has been emerging, our patient numbers have definitely gone up. So we try to do our best to keep the distance, but we are definitely pushed.
A few meters away lies a woman who has just been told she is positive for COVID-19, but she is hopeful.
I'm recovering. That's what I would say. Recovering, yes. Yeah.
Okay. How long have you been here?
Okay, just a day. Yes.
Some of your loved ones know about this. How did they receive the news? You seem to be okay with it, but your family, your close friends that you disclose it to, how are they taking it?
Some are shocked. Some are shocked, some are sad. And I keep telling them they should be fine, because this is real. If I never know it is real until I also had it. So they should rather keep calm and then stay safe, rather. So they are a bit scared, but me, I'm fine. I know it's one of those things. It will come and it will go. So I'm positive.
As more easing of restrictions are expected, it is important for health workers here to be assured that the general public is continuing to adhere to safety protocols so as to not cause a spike in the number of COVID-19 cases in the country. Reporting for Citi News, I am Ni Ama.